So, Bianca, the world is pretty bleak at the moment, and I'm not just talking about COVID. I suspect I know a number of our community, and I'm one of them. We've been quite challenged by events in the world, whether it's Afghanistan or Haiti or any of those other places. So adults are becoming anxious, parents are becoming anxious. Do you have any words of advice, please, for the adults that are in turn trying to manage the children and they themselves are feeling, some degree of anxiety?
Yeah, I think it's really hard at the moment with so many different competing challenges that we've got in our lives. COVID is one of them, but there's also the worry from international stresses, stresses of work, balancing the juggle of how do you maintain your children and doing a good job in their education at home and having to work. I think there's lots and lots of stresses. I think something that I find really important is how can you simplify things for yourself, reduce some of the load. I think we take on lots of things, but we don't actually have to do it all. There are things that we can say, actually, I don't need to clean the house this week. I actually made that choice this week. Yesterday was my day off work, and I made the choice to actually spend the day with my kids, helping them with school, rather than cleaning the house, which is what I would usually do. So this week, giving it a miss. Yeah, it's going to be dusty and worse next week, but hey, we'll be okay. So it's making those sort of choices. What things can you drop? What things do you not need to do?
Now, I reckon there's a huge element, having been a working mother myself, how that's actually, it sounds easy to say, what can I drop? But often working mums, and absolutely, can I say every mum is a worker? Let me make that clear. But it is really, really hard to kind of work out that it is okay and rationalise that it is okay to, for instance, not clean the house. I know people talk about in the aeroplanes, the adults need to put the oxygen on first before we look after the children. Bianca, does that apply in this situation?
Oh, completely. Most certainly does. If we're not looking after ourselves, if we're not taking breaks, there's no way we can actually support our kids and help them get through everything that they need to do. We can't be there emotionally if we're not coping ourselves. So it's the important thing is, how do you reduce some of the stress for yourself? Make time to go for a walk. Make time in the morning to sit down, have a cup of tea, plan out your day, work out a bit of a plan for what's happening with meals for your family. I mean, lunchtime and recess in my house is, well, all day, isn't it? The kids want to eat all day. So it's plan out some of those things for yourself. So that's one less thing that you need to think about. And yeah, it hopefully can simplify things a bit for yourself, and that you can look after yourself first. So give ourselves permission. Yeah. Give ourselves permission to not do.
Yeah. Michelle, I'd like to pass on the next question, which is, so we've said, okay, it's good to give ourselves permission to let go of something. Have you got any advice on how we as adults, whether we're mums or dads or carers or whatever, how we decide what it is that we can either let go of or work out what works for us to decrease our anxiety levels?
Thank you, Annette. I think it's important for us just to acknowledge that looking after ourselves and the self-care practices that we might adopt, that they, what works well for one person or what might work well really for you might not work well for someone else. But I would say that there are what I would call 4 general self-care or positive coping behaviours that are scientifically linked to reduced stress and worries and improved well-being. And they are, number 1, connecting with other people. Number 2, being active. Number 3, being loving and kind and generous. And number 4, being mindful. And in the work that I do, I often group these evidence-based positive coping or self-care practices into what I call the CALM framework, and that incorporates C for connected, and A for active, L for loving, and M for mindful. And when I'm working with people, I always encourage them to reflect and think back to what's worked well in the past. And that will probably help you to work out what will work well for you now.
Now, I don't know, and this relates to the next question, and Michelle, I might follow up on that a little bit if I may. But for some of the families that I've been talking to, and friends and colleagues and all the rest of it, the people, the parents, the adults have kind of already, I won't say lost the plot, but, you know, it's already created a situation which is very anxious. There's fighting in the family. There's tension between whether it's mum and dad, or mum and the children, or dad and the children. Is it too late? How if we've sort of set a little baseline of things not going so brilliantly, can we pull back on that? Can we retrieve the situation, I guess is what I'm saying.
Yes, definitely. There's always hope. And I guess when it comes to conflict between family members, whether that's between parents and children or between the adults in the home, I think what's really important in those situations is to approach any conflict or differences with curiosity, which is, as you know, one of our school values, rather than correctness and being right. And I think it's always really important to try and have or demonstrate a genuine desire to understand how things are going from the other person's perspective.
I think that is actually a very wise comment. And if I could just come in, I know in my role and some of the training I've done as a coach, a professional life coach, is, you know, that term, help me to understand. So, it's not aggressive, but it is based on curiosity and the genuine interest. So look, that's quite a hopeful and positive thing to hear, without a doubt. Bianca, I know that for some of us, it has, young people and older people, it has got to the stage where we feel we need some sort of external support. I'm also conscious that a lot of those external support agencies are incredibly busy. We're hearing a lot on the media about how overstretched places like Lifeline, etc. are. So do you think we're at the stage where we do need to turn to the self to develop our own sort of schemas and procedures for self-support? Do you think that is worth doing, and that in a way we can't, and this is a question without notice and I apologise, that our usual capacity as a society to rely on external providers of mental health support, they're possibly not there at the moment, or am I reading the situation incorrectly?
Look, I know that most services are very full, but there are always places that do have some capacity. So I think part of the challenge is doing the ring around and trying lots of different places if you are seeking external support. Lifeline probably will be the most used phone service because it's the one that is publicised everywhere. And actually a lot of services link in with Lifeline. So there is always a lot of demand for Lifeline. The thing is, there are a heap of other places that you can access support. So for young people, often they forget that there are other options. So it's not just Kids Helpline and Lifeline, but there are lots of different places that you can seek help. The other thing to consider for yourself is, what self-help things can you put in place? How do you put in some nice routine and structure within your life that will help calm things down? So anxiety feeds on the unknown and the unpredictable. So how can you make your life a bit more predictable? Yes, we can't change the the up and down of lockdown and not lockdown, and the not knowing of that. But what things can we control? How do we make our lives a bit more predictable and a bit more contained, so it keeps us feeling less out of control, and that can help calm some of it down. And then it's working out, who can you talk to? Do you have friends that you can have a chat with to debrief some of these things with? Who are other people within your community that you can reach out to? And if those people in your life aren't providing the level of support that you're needing, if you're needing the next level up from that, then go see your GP, have a chat with them. They can often work out some other ideas of places where you can go and you can seek support.
And I might take this opportunity to remind people that should your children be old enough to have a school diary, there's a whole list in the school diary of possible support places. If you have very little children who may not have a school diary, then absolutely please do contact the school, because there's certainly a range of folk out there.
Yeah. And the other thing, Annette, is that we do have capacity at school to support people, and we can also help advise parents on where they can access support for themselves through if they contact their classroom teacher or their child's mentor. We can help work out what services are available and that may have some capacity in the not too distant future.
So don't feel you are alone. I think that's the key message here. We know schools in times of stress, whether it's a pandemic or a natural disaster, apparently schools become a bit of a go-to place for families and for community, which is not surprising. I will say, and I'm thinking particularly about last year, which was in some ways a bit more challenging than in very different ways than this year, but we know a lot of people turn to the school and to all schools to say, how do we deal with whatever it is? And though I will emphasise that we sometimes get information at the same time as the families, but one thing we do perhaps have a little bit more information on is things like where to go if you do need support. So please be aware of this. Now, the next question I think is an interesting one, and I declare a little bit of self-interest in this, and it has come from a few conversations with in this case adults and parents, and some of us are a little bit worried because we've been in lockdown, and though we enjoy doing what we do, but there's almost a sense of agrophobia, and I've heard this from quite a few people developing, so that should we have to go to the supermarket or whatever it is, there's almost a reluctance and a sort of a level of fear creeping in, partly to do with the risk of infection, but partly perhaps to do with, gosh, I haven't been there for so long. Is this to be expected? Because I'm hearing it from a few adults. And I might direct it to Michelle, actually. Sorry, I haven't specified there, but obviously Bianca, pipe up if you want to. Yeah.
I think I would say that fearing going out and fearing public spaces while we have COVID in our community is a normal response to a potentially threatening event. And I think it's really normal to have some fear because the threat is real. And I think what's important is to really ask yourself whether that fear is in line with the potential danger and whether or not you're avoiding more situations than necessary. And I would just add that if you're concerned or worried about your level of anxiety, or if the people around you are worried about your level of anxiety, I'd recommend speaking with a mental health professional, and they can help you to work out whether that fear is healthy or not.
Yeah, look, it is really interesting. And I guess that that sense of, and I know we talked a little bit about this in the last session, we all feel things to different levels and we feel what we feel. And that idea, and I don't know if one of you want to comment on this, but that idea of what is normal in an unusual situation like this has kind of gone out the window. Do you think that's the case, Michelle?
Yes, I think so. I guess, like I said, about whether this fear of public spaces or places is normal. What's really important is to look at whether it's in line with the potential danger, whether or not you're avoiding more situations than necessary, and really whether or not it's getting in the way of you being able to do what you would normally like to be able to do, if it's interfering unnecessarily with your life.
Actually, that's really helpful. If it is interfering, that might be a sign that you might need some more serious or more targeted intervention. Thank you. That's actually really helpful. Now, the next one. Sorry, Bianca, go on.
Yeah, I was just going to say that's sort of how I tend to conceptualise if someone's anxious out of proportion to the situation, is if it stops you from doing things that you want to do, if it stops you going to the supermarket, if it stops you going for a walk, then that is possibly out of proportion to the current situation. I mean, the supermarket's a bit of a funny one because, yes, there is a real risk there. Going for a walk, there is not that much risk. So it's proportional to, to the situation that you're in.
Mm. And look, I think we all know people that in many ways are enjoying the lockdown. They're enjoying that they don't have to go out and interact necessarily with other people. And that's perhaps a topic for another night, I've got to say. Now, the next question I thought was a really interesting one, and it came from a parent earlier today. And it almost reminds me of the survivor guilt complex that perhaps different people feel at different times. And this will sound a bit bizarre potentially to some of the listeners, but it was to do with a family whose children are eligible to attend support school. And this very delightful parent was saying to me, look, I actually feel guilty because my kids can go. So I'm going to ask perhaps Michelle to comment on that in a minute. But while I am talking to the people here, can I say and remind people that in terms of support school, there are two avenues. One is if the parents are deemed essential or, approved workers, or you work for a business that is deemed an essential service. But the second avenue is the school can, in consultation with me or the head of school in the case of junior school, consider the case, and if the school deems the child vulnerable, and this was in the newspapers on the weekend as well, and what does that mean for our school? Well, for our school, it means that we know the young people potentially might be at risk of some negative mental health situations, and Bianca and Michelle are both very involved in that. Also, if children are learning diversity children, if they need extensive support, it is the case that we are happy to support them. Then there is the case that if the child can be deemed to suffer extensively by being kept at home. Now, one of the situations that is the case is where the home language might be different to English and the child is fairly little, and their capacity to speak English may be compromised if they don't attend on site. So, look, it's worth a conversation. If any of you are not sure, I would encourage you to pick up the phone and speak to the school, speak to myself, speak to Louise Sayer, and we can discuss what might be possible there. But going back to this idea of survivor guilt, because I thought that was a really interesting thing that this parent raised, and I could kind of understand it because we know there's so many families out there that are doing it tough. So, Michelle, I don't know that there's an answer to that, but is it expected?
I think that, well, firstly, guilt's an emotion, and it's strongly linked to empathy or feeling responsible for how our behaviour might affect other people or the people around us. And most of us experience guilt at one time or another, and it's not always helpful, and it can cause distress, especially when we think that we're not being a good enough person, perhaps. And when I'm working with people who are experiencing guilt, I recommend talking about those feelings with a loved one. And I also recommend practicing self-compassion. So, for example, you might try to talk to yourself like you would a good friend, So you might say, you know, to yourself, what would you say to a good friend who might be experiencing those same feelings? And doing that and practicing self-compassion can help us to release and resolve some of those uncomfortable feelings.
That's interesting because, look, you know, as I said, I was not surprised, but it was interesting to hear those comments, and they were from some of our